20 years of innovation, industry leadership, and superior quality products have made Restorative Care of America one of the world's leading manufacturers of innovative restorative care products. RCAI, setting the standard in orthotic technology. RCAI products are handcrafted in the United States, using processes and materials that ensure they will last. Tested in leading teaching hospitals across the country, these prefabricated orthoses are easy to apply and easy to maintain. They're made of a heat-moldable thermoplastic for custom modifications and are available in a variety of models and sizes. RCAI hand orthoses offer a variety of therapeutic positions following injury or surgery, provide support to unstable wrists, and can be used for the prevention and treatment of wrist, finger, and thumb contractures. Prefabricated splints reduce the time required for custom fabrication, reducing budgetary costs. Washable straps and liners are cosmetically acceptable and assure skin integrity. RCAI hand orthoses are made of heat-moldable Kydex plastic, which can be shaped and fitted to meet individual patient requirements. The liners covering the splints are made of a breathable Orthowick material that absorbs perspiration away from the patient's skin. Lightweight yet durable, the Kydex construction of the orthoses allows the splints to be heated and reheated as often as necessary, accommodating patient improvements. To heat mold RCAI hand splints, first remove the liner with straps and any Velcro strips in the areas to be heated and reshaped. Hold the heat gun 2 to 4 inches over the Kydex and heat evenly for approximately 30 seconds or until it becomes pliable. While the Kydex is still warm, bend the splint to the desired shape and allow to cool. During this process, you may use a cloth or towel if you find the plastic is too warm for your hands. The Resting Hand Orthosis by RCAI offers a resting hand position following injury or post-surgical conditions, provides support to unstable wrists, and can be used for the treatment and prevention of wrist, finger, and thumb contractures. The medial and lateral ridges of the palmar support aid in the control of radial or ulnar deviation. Before applying the splint, prepare it by arranging the Velcro straps out of the way. Extend the patient's fingers and thumb by placing them in the orthosis and attach the wrist strap. If the wrist or thumb does not rest comfortably in the splint, remove the splint for heat molding. Attach the finger and optional MP strap over the hand. The MP strap can be repositioned where needed or placed over the wrist for additional wrist leverage. Secure the thumb strap around the thumb and secure the remaining forearm strap. Check the thumb and fingertips for excessive pressure. Straps should be firm but not tight enough to cause pressure or restrict circulation. The resting hand is available with a finger separator liner that promotes abduction and skin integrity between the fingers and encourages proper finger positioning. The RCAI Geriatric Hand Orthosis provides support for unstable wrists and treats wrist, finger, and moderate to severe thumb contractures. The lateral ridge of the palmar support aids in the control of ulnar deviation. The geriatric hand features interchangeable thumb rolls for progressive thumb abduction for the tightly adducted thumb. The geriatric hand is available with or without finger separators, which promote abduction and skin integrity between the fingers and encourage proper finger positioning. Made of heat-moldable Kydex for patient customization, the built-in memory retention of the thermoplastic provides dynamic tension. Before applying the orthosis, prepare it by arranging the Velcro straps out of the way. Pre-position the patient's fingers and thumb by manually stretching as prescribed by therapy. Extend the fingers and thumb by placing them in the orthosis and attach wrist strap. If the wrist or fingers do not rest comfortably in the splint, remove the splint for heat molding. If the thumb roll is not the correct size, replace it with the extra roll packaged with the splint. This can be done by opening the thumb roll pocket of the liner and replacing the roll. Secure the thumb strap over the thumb, followed by the forearm strap. The finger strap can be positioned two ways. It can be positioned directly over the MP joints and secured in the palmar area, or positioned diagonally across the MP joints and secured to the back of the wrist strap. Check for excessive pressure. The strap should be snug, but not tight enough to restrict circulation. The RCAI Contour Hand Orthosis is indicated for the contracted or fisted hand. 2 sizes of interchangeable palmar rolls offer progressive finger extension. Constructed of either a lightweight polymer or heat-moldable kydex, the orthoses may be shaped and fitted to meet individual patient needs. Before applying the orthosis, prepare it by arranging the Velcro straps out of the way. Bend the white polymer splint to the desired degree of angle with your hands, or heat mold the black kydex with your heat gun. Pre-position the fingers and thumb by manually stretching as prescribed by therapy. Place the palm over the hand roll of the orthosis. If the roll is not the correct size, replace it with the extra roll packaged with the splint. This can be done by removing the splint from the liner and replacing the foam roll over the palmar bar. The thumb should rest around the back of the palmar roll. If it is difficult to wrap the thumb around the small roll provided, allow the thumb to rest over the top of the roll until increased thumb extension is achieved. Secure the wrist strap over the wrist, followed by the MP strap and remaining forearm strap. Strap should be firm, but not tight enough to restrict circulation. The contour hand is available with a lengthened forearm and finger separator liner. The lengthened forearm assures optimal wrist leverage, while the finger separators promote abduction and skin integrity between the fingers, encouraging proper finger positioning. The RCAI Opponent Hand Orthosis supports the palmar arches of the hand while allowing free wrist movement. The medial and lateral ridges of the orthosis aid in the control of radial or ulnar deviation. The opponent hand is indicated in the early stages of finger and thumb contracture. Before applying the orthosis, prepare it by arranging the Velcro straps out of the way. Pre-position the fingers and thumb by manually stretching as prescribed by therapy. Extend the fingers and thumb by placing them in the orthosis. If the thumb does not fit comfortably in the splint, remove the splint for heat molding. Attach the middle strap over the MP joints and secure the thumb strap over the thumb. Attach the wrist strap around the wrist and the remaining finger strap over the IP joints. Check for excessive pressure. The strap should be snug, but not tight enough to restrict circulation. The newest addition to the RCAI hand splint family is the Wrist Hand Immobilizer. It limits wrist motion and maintains support for strains, sprains, postoperative rehabilitation, and cumulative wrist trauma. Made of open cell foam, the splint allows the skin to breathe, increasing patient tolerance and comfort. Removable, adjustable aluminum volar and dorsal support bars help keep the wrist in neutral position, preventing unwanted flexion or extension without restricting motion of the fingers and thumb. To apply the wrist immobilizer, open the loop and lock D-ring straps and Velcro tabs. Position the thumb through the cuff hole. Fold the flap over the back of the hand and Velcro to opposite side of flap. Align the palmar stay so it is parallel to the arm. The palmar stay can be reformed if necessary. Wrap the remaining cuff around the forearm and attach the Velcro tabs. The dorsal stays of the wrist immobilizer are attached to the splint. They may be reformed for proper wrist positioning or moved for proper alignment with the center of the back of the hand. Wrap the distal strap around the hand through the D-ring. Wrap the remaining straps around the forearm and through the remaining D-rings. Adjust the straps to the desired tightness. Liners for the RCAI hand orthoses can be removed and washed in warm water. Always use a mild detergent and never use bleach. After washing, allow to air dry or dry on low tumble cycle. Straps are sewn to the liners to prevent loss in the laundry. It is recommended to close Velcro closures before laundering. Even though RCAI hand orthoses can be cleaned, they cannot be sterilized. Since there is a risk of cross-contamination, all RCAI hand orthoses are intended for single patient use only. We hope you have found this videotape helpful and informative. If you have any questions, call our customer service department at 1-800-627-1595.